So my name is Gail Hollis. I am trying to click into the next slide, and with not much success. Okay, here we go. I'm the director of the Manitoba PIHCI network, and today we're going to be focusing on several CIHR requirements as strategies to optimize research proposal development so they're more strategically aligned with CIHR's requirements and therefore more competitive. So first I'll provide a brief overview of SPORE, PIHCI, and MPN and the upcoming CIHR funding opportunities falling under this initiative. I'll introduce the 10 CIHR requirements, of which this webinar will be focusing on 2. So firstly, intersecting with policy and decision makers, and secondly, meaningfully engaging with patients in the research endeavor. So it's our hope that this will initiate a question and answer session at the end after all the presentations are complete, and we can delve in and perhaps further strategize how CIHR requirements can be more successfully addressed in future research proposals. So of course we're open to any other questions you might have, and I hope you'll take the opportunity to provide your questions in the chat box on the right of the WebEx screen, whether it's during the presentation or afterward. These presentations in this webinar are being recorded, so they'll be available for later viewing along with all of your questions and answers. So in the following slides, I've got a fair bit of information just simply because we're going to be putting it on the web page afterwards. But for our purposes here today, I'll simply highlight a few points. First off, there's a few interrelated pieces around CIHR's SPORE initiative that some people have found confusing. So those of you who know exactly what's going on, bear with me. And for some of the newcomers to the webinar, hopefully this will provide some clarification. The information basically here on these slides is directly from CIHR's webpage, which you can see at the bottom of the slide here. Quite simply, SPORE is a strategy that aims to support knowledge and evidence that will improve healthcare systems and practice with improvements that are evident at the point of care. So as you can see from this definition, it's very much centered on the patient. So you can think of this as an umbrella strategy. And under the umbrella strategy, there are support units throughout almost every province and territory in Canada. Their objectives are listed here. Again, it's directly from the CIHR webpage, SPORE webpage. The support units are designed to support research teams. So as you can see in blue font, it's everything from facilitating research, providing methodological expertise along the entire research process, as well as providing training around methods and as well access to data. So in Manitoba here, our support unit is the George and Fahey Centre for Healthcare Innovation, or CHI, as you probably have more commonly heard it being referred to. And what is PIHCI and what is MPN? So another initiative under SPORE is the development of research networks. PIHCI is the acronym for Primary and Integrated Healthcare Innovation, which we have further shortened to MPN to identify the Manitoba network. But the PIHCI networks exist in almost every province and territory in Canada, so it's basically a network of networks. The objective of the Manitoba network, MPN, is to develop, evaluate, and scale up new approaches to the delivery of horizontally and vertically integrated services within and across sectors of healthcare, so like public health, home and community care, primary, secondary, and tertiary care, but as well outside the health sector, so also sectors like education, social services, and housing. So you might notice there's a theme of crossing over here that speaks to much of the way in which this network operates and the objectives of the research. So crossing disciplines, crossing sectors, programs, jurisdictions, with the overall goal of addressing complexity, which is really something that's very well suited to the work of a network. So we see MPN's role as strategically connecting and aligning people, resources, and opportunities from multiple sectors and jurisdictions, so collaborative teams can generate evidence to inform primary and integrated healthcare innovation. I've had a few questions about membership, and I think we're using this term quite loosely as we really don't have a formal means of defining the way someone chooses to participate in the network. Rather, it's simply to create opportunities and facilitate connections between teams and projects that are developing within Manitoba and across Canada. So here's a synopsis of the research priorities for MPN. The complete document outlining these priorities is on the MPN webpage, and it's available for you to examine in greater detail. However, for now, I'd like to draw your attention to the fact that there's particular populations that have been identified, as well as issues such as high system users, service coordination, a range of mental health considerations, and transitions along the care continuum. So indeed, there's a complexity related to systems and practices for improving patient outcomes and patient-related experiences. And it's this complexity that we think requires approaches informed by a breadth of expertise. So it's expected that the networks in each jurisdiction support the research that is cross-sectoral and cross-disciplinary. So now moving on to perhaps some of the more exciting stuff is 3 funding opportunities that are going to be emerging in the spring, and so fairly shortly. The first launch for a knowledge synthesis grant will be in late April and will support research teams with $25,000 from CHR with the expectation of matching funding from other sources. However, these sources cannot be Tri-Council agency funds. The first launch of a comparative data or policy analysis grant will be coming around in May with $62,500 for 2 years, and again with matching funding required. Both of these are due probably in mid-September or so. That official call has yet to come out though. And there's currently some negotiation around dates for a multi-year large grant to fund 4 teams at $250,000 per year over 4 years, and again with the required matching funding. Originally, the call was set for June with a submission deadline of September as well. However, it's hoped that this might be postponed by a few months, and I'll keep you updated by way of a listserv and our webpage as more information becomes available. But I am raising this now as I think it's a significant opportunity with a significant funding amount for project ideas and teams that can start developing perhaps sooner than later. Now, the requirements that CHR has set out, there are 10 of them. And as mentioned earlier, the overall goal of addressing complexity is something that is well suited to the work of a network. And these 10 requirements are outlined here. However, the ones in green are where we'll be focusing today. And as you can see, we are primarily addressing that common theme of crossing over. So again, crossing disciplines, sectors, programs, and jurisdictions. One of the key elements in the development of applications will be ensuring that a strong team of experts and stakeholders are involved in the research. In other words, meaningful involvement of individuals beyond academic research with better integration of decision makers, practitioners, and patients or community members. So points number 3 and 4 here will be the focus of the webinar discussion, as this is where some challenges seem to reside. That is bringing in stakeholders who perhaps haven't had a huge role within research in the past. But I do want to emphasize that MPN has expanded membership with active involvement of over 85 stakeholders across policy, research, and practice sectors, and represent health service delivery organizations across the care continuum. So currently we have members from all 5 regions of Manitoba, community-based practices, academic organizations, primary health care organizations, hospitals, specialist clinics, and Aboriginal organizations, as well as members from beyond health services, including social services, housing, and education. So we have a solid foundation for making connections and bridging experts, and we hope to continue to grow this aspect of the network. So before moving on to the 2 webinar topics, I'd like to point out that with regard to number 6, partnerships to develop research capacity, MPN members represent a number of interdisciplinary research centers within this new Faculty of Health Sciences at the University of Manitoba, and we have good working partnership with the Center for Healthcare Innovation, the Department of Family Medicine, and are working on branching out to academics at the University of Winnipeg, Red River College, and Brandon University. So there's also an expectation to support and facilitate research capacity building through graduate student research mentorship as part of the studies that are generated under the PIHCI network. So lots of work to be done under number 6. The network also needs to continue to broaden its research across the province. CHR has required that MPN activities reach a minimum percentage of the distributed population, And as mentioned, we currently have members who are geographically dispersed. We also have a comprehensive amount of data on patients throughout Manitoba, and so this is a priority for the network as well. And finally, a quick word about partnership funding. Research Manitoba provides partner funding to support our network operations and has also committed an envelope of funding projects developing under the PIHCI initiative. There's not enough funding, of course, to support all projects. However, we in Manitoba here are in a very fortunate position to have the partner funding support of Research Manitoba. We're finalizing the submission process, which will include a letter of intent phase for research teams requesting Research Manitoba partner funding. This entire submission process is still yet to be more thoroughly described and confirmed outside of this webinar, and potentially a topic for a future webinar. But as always, I'd be happy to respond to your questions about this application process as it's confirmed and announced. So that brings me to the end of my portion of the presentation.